It's the Newsmaker Show. I'm Bryan O'Neill, and I just got a phone call and now being joined by St. James CEO Bryan ODonovan. Bryan, St. James as of this week started doing the elective or unnecessary surgeries, as some say, and ambulatory treatments. Wondering, how is that going?
Were elective, meaning that they weren't urgent or emergent. Well, some of these cases have turned into urgent or emergent over the last 6 or 7 weeks, and Dr. Mayer would have joined us. He's in the OR doing these cases and procedures today, and I think it's you think of endoscopy, GI endoscopy screening, and those types of things, and breast imaging. You don't want to put those screenings off for very long, because if, in the unfortunate event, something is found, the intervention can happen that much quicker. And so I think this is a big advantage overall for the hospitals in upstate New York. And I do think, moving forward, it's going to be a little bit different. I mean, we're not putting patients' families together in the waiting room for our operating room or our surgery center. We are implementing all of the appropriate safety measures, and some of that, Bryan, is spacing out cases much further than we normally would do to make sure that we are adhering to social distancing guidelines, as well as masking and the other precautionary measures that we need to take to keep our patients and our staff safe.
Last week, hospital doctors put out statements saying not to avoid going into the hospital, especially if you needed an ER visit. The doctors, Dr. Ashdown, Dr. Robshaw, and others, what they said was people seem to be fearful of coming into the emergency room or other places out of a fear of catching COVID-19. So they put out a statement explaining that the COVID patients were in a different section, and you were not going to catch COVID-19 if you walked into St. James. Wondering, has the situation lessened after that statement was put out?
It has. And I think, Bryan, coming from physicians is a very different message than coming from me. I mean, these physicians, they've been around quite a long time, and they're the ones that are taking direct care of our patients. I think the one thing that's really crucial to know is, we've had 20 to 30 inpatient COVID positives, and we've done such a good job with PPE and not exposing our staff or other patients. And now what we're seeing is a decrease. This is the first time in 5 days in a row, at least the testing that we have done, and we're usually doing about 15 to 20 COVID tests a day throughout our organization on patients. We had zeros 5 days in a row, zero positives out of, let's say, 50 to 60 tests. So I'm extremely encouraged by this. We have not seen that, a stretch of zero positives at St. James in at least 6 to 7 weeks. So there is definitely light at the end of the tunnel here, and I give a lot of credit to the community for really taking the social distancing measures seriously, as well as our team here using personal protective equipment and the other precautionary measures that we've implemented.
Does it ever occur to you, Bryan ODonovan, the CEO of St. James, here you are now, a CEO of a small-town hospital. Does it ever hit you when you're in your workplace how many great doctors they are, both the hometown doctors and those who have come to live here from other states and countries?
Every day. So I can tell you, I've come from big systems, Bryan. I worked for the U of R for 10 years, and still, obviously as an affiliate, I've worked in heart transplant. I've been the administrator there. I've opened other medical ambulatory centers. And, these doctors are on par with the doctors that I've worked with at other places. And, I look at the John Robshaws, I look at the Izzy Mayers, and I just look around at, our current medical staff, as well as the additional medical staff, the 15 new medical staff that we've added. And we really have such a great diversity and plethora of our medical staff. So it does. And I can tell you, watching, Izzy intubate patients, John Robshaw and many others, it's definitely humbling, and I'm, very grateful to be a part of this team.
Donations coming into St. James during this COVID situation. How's that been going?
It's been awesome. I mean, really, you know, our team, we're so focused. Let's take the first 3 or 4 weeks and physically exhausted. My team was physically exhausted and emotionally exhausted. And then you get, you know, these free lunches, or we had this awesome family that decided, I think the boys were like 4 and 6, and pardon me if I get their ages wrong, they go out and they paint rocks. And they bring these rocks in with these cool messages on them. And, you know, and it doesn't stop there. I mean, I think we've been tallying the spreadsheet of all the donations. You know, we're at like 80 different either organizations or people that have thought about us and taken the time to donate. And it means a ton, you know, to our team here when they're so focused on patient care. But, you know, it is, I think it's a great piece of humanity. I think this community is really quite fantastic. I mean, really stellar.
St. James CEO Bryan ODonovan, I want to thank you so much for joining us today on Newsmaker.
Yeah, thank you, Brian. Have a great weekend.
Thank you very much. It's AM 1480 WLEA Hornell.
Send the link, Katrina.